Did you know that 1 in 3 people will develop cancer in their lifetime? This statistic is quite steep, and it likely means that someone you know or love has or will have cancer. Because of its prevalence, it's important to know more about cancer and explore ways in which we can take action in its prevention or through solutions offered by charities. Today, our team will discuss the problem of cancer as well as our charities, the American Cancer Society, presented by Ian Bell, and the second charity presented by Jocelyn Stafford. First, let's take a look at the history of cancer. According to the American Cancer Society, the earliest evidence of cancer is found among fossilized bone tumors, human mummies in ancient Egypt, and ancient manuscripts like the Edwin Smith Papyrus, which is pictured here in this slide. The oldest description of cancer in Egypt dates back to 3000 BC, and it describes 8 cases of tumors or ulcers found in breast tissue, which was removed by cauterization using a tool called the fire drill. The word cancer is credited to Hippocrates around 400 BC. A better understanding of the human body came about during the Renaissance and the development of science. In 1761, Giovanni Morgani began to perform autopsies to relate patient illness to pathologic findings after death. This laid the foundation for scientific oncology, which is the study of cancer. Oncology developed more in the 19th century with the use of the modern microscope to study diseased tissue. So, now that we've discussed a little of the history of cancer, let's move on to the present situation of cancer. According to the National Cancer Institute, it is estimated that 2 million people will be diagnosed with cancer in 2024. The National Cancer Institute also states that breast, lung and bronchus, colorectal, and prostate cancers account for 50% of all new cancer cases, as you can see in this slide. With that being said, lung and bronchus, colorectal, pancreatic, and breast cancers are responsible for nearly 50% of all cancer-related deaths. There are a number of factors that can contribute to cancer. According to the Nationwide Children's Hospital, many factors altogether can lead to cancer, such as lifestyle choices, which include smoking, poor nutrition, sun exposure, or physical inactivity. Family history and genetics can also play a role in developing cancer. There are a variety of current methods to treat cancer. According to the National Cancer Institute, some people will only use one method of treatment, but mostly they will use a combination of treatments. Treatments can include chemotherapy, hormone therapy, immune therapy, radiation, stem cell transplant, and surgery to remove the cancer. So, now that we have talked about the present situation of cancer, let's look at the possible future of cancer. The future can be looked at in a few different ways. For one, technology is constantly advancing. According to the World Economic Forum, one newer breakthrough in the fight against cancer is personalized cancer vaccines. Trials could soon begin for these vaccines that are designed to prime your immune system, to target cancer cells, and reduce recurrence risk. Another development is a blood test in the United States that they say can identify 18 early-stage cancers in a process similar to this image. Research is hopeful that this test will pave the way for cost-effective, highly accurate screening tests that can be implemented on a population-wide scale. As far as a cure for cancer, there's not much to say on that. The American Cancer Society says that when doctors deem the treatment successful, they will say that the cancer is in remission and not that it is cured. A big part of the future lies in prevention. Prevention can lower your risk of getting many common forms of cancer. According to the Center for Disease Control, some preventative actions include avoiding tobacco, wearing sunscreen or sun protective clothing, limit your alcohol intake, and stay active. Other forms of prevention can be screening tests and vaccines for viruses that can lead to cancer. Now that we have discussed the problem, the history, the current situation, and the future possibility of cancer, Ian will present to you the American Cancer Society. To conclude, cancer is a problem that affects millions of people worldwide. It has a long history and many possible futures. And you can take action through solutions provided by charities such as the American Cancer Society and our second charity.